Remember, you're moving from a place where people are on vacation, having fun and leisure.
So laughter,
you're
celebratory.
Yeah, so I actually, that's why being in healthcare, I found it very satisfying. Yeah, because you are working towards a purpose and a goal. And when you can see the results of your work. So at the end of the day, like for me, when I was working at Gertrude, and we had a playground. I used to know we've done a good job. When sick kids are full of the playground, they've come back very ill, they've recovered, now they can swing, they can play, they can bounce around. And I say, wow, this is really nice.
Okay. Welcome to Daktari Tone, where voices, perspectives, and sounds relating to healthcare practitioners and matters health are amplified. This is a podcast by Daktari Online, created for healthcare professionals across Kenya. Each episode brings you honest conversations, expert insights, and real-life stories from the front lines of care. Hello and welcome to another episode of the Daktari Tone podcast, where voices, sounds, and perspectives of healthcare practitioners are amplified. Today with me, I'm graced to be joined by a healthcare leader, Gordon, who has served for over 13 years in the greatest leadership roles as a CEO at the Gertrude and later Nairobi Hospital. So let's dive into this conversation and get to learn most about leadership and his journey through healthcare.
Thank you, Kerubu. And as you mentioned, my name is Gordon Otieno Odundo, and I've worked in the healthcare industry for now over nearly 25 years. 15 of those, I've been the CEO of the Gertrude Children's Hospital for 13, and 2 years at the Nairobi Hospital.
Wow. Okay. So if you could take us back to you being, but before I ask that question, let me first ask, what did you study or major in school?
So the biggest challenge I've always faced, not challenge, but when I introduce myself and people I work with, they always assume I'm a doctor.
Doctor, exactly.
So I get called by the watchman doctor at the golf club. I go, they say Daktari, but I'm not a medical doctor. And then the people ask me, then how could you have led a healthcare institution and you're not a doctor? And I tell them, no, I grew up and studied hospitality. So I trained in hospitality, hospital.
Service.
Service industry. In the hospital industry, I trained for over 4 years and I worked there for over 11 years and leading and managing teams. I left at the title of Deputy General Manager. That's before I now moved into healthcare.
So how did, the non-medical profession get to now run hospitals? Because that's later. So that's the background of what you had majored in, that is training in the hospitality field. But then now, how did Gordon find himself in?
So it came during a moment of reflection.
Okay.
And I actually applied for a job at the Gertrude Children's Hospital because when I looked at what they wanted a chief operating officer, and what they wanted the person to do, I thought that's actually what I could do. And so I went in to be the chief operating officer, but I had another role to be the deputy CEO for that time. And I served as deputy CEO for 4 years. That allowed me several things, to have access to very top leadership decisions because I used to attend every single board meeting. And then I also benefited for training in hospital management during that time at Leeds University. So that is my conversion. But remember, there's a lot of similarity between the two words.
Okay, yes, there is, and also confusing.
Hospitals
and hospitality, exactly. And now, the interesting part is the fact that you've said, because you're so specific with numbers, which is also interesting and something that I'm taking note of, 11 years in practice of hospitality.
Yes.
And then now there's this job opportunity as a COO at Gertrude.
Yes.
So then you get an interest through that.
Yes.
You get to become a deputy CEO,
yes,
right?
Yes.
Now, how do you get to transition? Did you like it being there? Because as much as, yes, the roles might be, roles can be something that you can offer, but then you're in a different space. as much as the names are almost.
So I think it could a lot to do maybe my background. Because my mother was a nurse, and so she I mean, so there are certain qualities that you start having: caring for people, empathy, and also wanting to be of service. So I felt that not to put the hospitality industry down, but hospitality industry is business, and you're chasing numbers. You're making people, you're meeting people on leisure. Healthcare, you actually are able to see a transformation of people's lives. You can see people very ill recovering. You can see,
sounds scary, because the leisure sounds fun. Then now we are having hospital sounds scary, like the way you're putting it.
It's true, because I had to do psychometric tests. And later when I was employed, I asked, what is the purpose of the psychometric test? And the psychometric test was trying to assess, can I fit into working in an environment where there's pain, there's suffering, there are crying babies and children.
Is huge.
And I remember when I was doing my interview, it was actually done at when I was doing the psychometric test. I was doing it in the CEO's office as they were doing other interviews, and I was doing the psychometrics, and there were children in pain and crying. So there also, I remember, there's also a point of reflection. Okay, is this the environment I want to work in? Is this, and remember, you're moving from a place where people are on vacation, having fun and leisure.
It's all laughter, you're celebratory.
Yes, so I actually, that's why being in healthcare, I found it very satisfying. Because you are working towards a purpose and a goal. And then you can see the results of your work. So at the end of the day, like for me, when I was working at Gertrude, and we had a playground. I used to know we've done a good job when sick kids are full of the playground. They've come back very ill, they've recovered, now they can swing, they can play, they can bounce around. And I say, wow, this is really nice.
Okay. Now, you also mentioned that you still had to take up now a course in, if I got it right.
Yes, I did hospital management in Leeds University.
What led to that? Is it the job now?
It was part of, I was working under an expatriate, and under expatriate conditional terms, they have to show that they are training a successor. And so that was part of, I benefited a lot from that. That was part of his objectives, to demonstrate that arranging for me to go in and train in hospital management at Leeds, he was actually training. And I think that was an excellent thing, because I learned the do's and don'ts of healthcare leadership.
I think we'll get into that. I would like to know what you learned and what you thought at that time, the perceptions and everything. But now, before we get there, what was it, the first week like CEO? Because you mentioned you did the CEO for 4 years. And then now transition now to CEO, deputy.
I had both, the two joint roles.
So the CEO and the deputy were joined.
Yes, one
Okay,
position.
so let's stick down to the CEO. How was it like for the first time now?
Being CEO? Well, I was ready for it.
Okay.
I felt, I used to attend board meetings. I used to work very close with my CEO. And the day it happened, it was unexpected. I was just approached and asked Gordon, if we offered you the CEO job, would you take it? And I didn't hesitate. I said yes. Because I was able, during the 4 years I was chief operating officer, to really transform the organization. So I was transforming in terms of, if I gave simple things, you see that in many institutions would have stalled vehicles in the car park, which people say these ones can be fixed. In my background, working with efficiency, we would actually get those vehicles back and working and even dispose of them. We started having very high standards of cleanliness. We focused on catering services. That's what chief operating officer. Basically, I was in charge of running the hospital on a day-to-day basis. So I got to know quite a lot about every in and out of the hospital without being the CEO, because I was working under the CEO.
And other than just now talking about a hospital in general, now this is children. I know you've mentioned the fact that you could see children coming in ill, then later seeing them in the playground, happy and joyful and all that. So how was that for you? You being in a children's hospital, and what is that one moment that you'd never forget?
It's very interesting. The first one moment that I'll never forget is I went to visit a friend on a Saturday, And as we were sitting in the house, children came running, and they said that there's a child had fallen into a pit in the neighborhood. And literally the child had drowned.
Okay.
So we got the child out of the pit. Luckily for me, the person I was visiting was a doctor who was a family friend. So we got this child out of the pit, dashed this child into the car. And so I can't remember whether I was the one driving or sitting next to the driver or something, but I was coordinating. And we were all the way in Kahawa, Sukari on a Saturday afternoon. That's the old Thika road, not the modern fast quick Thika road. And so the child was in the back seat with the doctor and the child's father. And we were doing CPR of the child. You not believe it, that child was brought to the casualty at the Gertrude hospital. Then it was not the modern casualty that you see, it was a prefabricated building. I'd call in advance, that patient was well received, and technically the patient was dead. The arms were stiff, the child was 3-year-old, the arms were stiff like this, which literally you say. So the team, the doctors, moved that patient to the ICU. They removed more than a liter of water out of the child's lungs. And guess what? It was a Saturday. On Monday, I'm doing my rounds in the hospital, and I walk outside the ICU, and the child was walking with the dad. And that child now is an adult and with no brain damage. I think went to university and finished. To me, that showed me that I was working for an institution with the highest level and caliber of trained people.
Yes.
And you could bring people back to life.
Because I can only imagine it.
Yes, that was very vivid to me. And many more. I've got many stories.
Of course. Now, from Gertrude to Nairobi Hospital, which is a private hospital, what did you say about that?
So I think I just need to explain something. The majority of the high standard hospitals, they're classified as private hospitals, but they're all non-profit. They're called private because people see them charging fees, and also people think they're expensive. The reason that they are perceived to be like that is because for them to be able to offer those services, it takes a lot. So they need money to buy equipment, they need money to pay the high quality stuff and all that, dry medicines, and keep the services going. So there's a perception where people call them private hospitals, but they're not owned by...
Actually, I've learned something new from you.
They don't have significant shareholders who have money. They're actually community hospitals. If you looked at even all the top ones in Nairobi and Mombasa, they're all what you call community.
Okay, so also Gertrude is a private hospital.
It's also categorized. It's a trust. Yeah.
But then, okay, now let me now put it this way. Now, from a children's hospital to now an overall private hospital.
Yes.
What did you find to have stayed the same or to be different with these two institutions?
I think there's a lot of similarities, only the scale of resources. So one would be operating at maybe a third of revenue of the other, but the challenges would all be the same. It's how do you motivate your staff? How do you keep the stakeholders who are visiting consultants happy? Are you giving them the services they need? Do they have equipment where they're working? How do you ensure high standards of patient quality and satisfaction? How are you compliant with regulatory authorities? So a lot of similarities, just the scale would be different.
Okay, great. Now, before I get into leadership and management, I'd like to ask you a few, icebreaker fun questions, where you're also allowed to ask me a question after each. So you've said that mostly when people see you, they call you Daktari or doctor.
Yes.
Do you get to have a minute and be like, no, I'm not a doctor, or tell them you're not, or you just like you embraced it?
I used to do that. No, because some have told me, even if you don't accept, we'll still call it doctor. So I just laugh about it. I say, okay, sawa. And then people ask me, so you don't, if people really tease me, I say I have treated people. And they say, what have you done? And I say, look, I've advised a lady on how to get pregnant at the gym, because I used to go and she was told this guy works in the hospital. And she told me her problems, and I gave her advice. After 3 months, she told me, do you know what? I'm now expecting a baby. So I say, okay, I didn't treat her. This just understanding the science behind it as a human being.
Of course, also you being in that space, it will get you to be just exposed in some information, which won't make you be 100% versed, but at least because of the interest, and of course you also being the CEO,
Yes.
you'll just be forced to
Yeah.
be aware.
But I always tell people to seek professional advice.
Exactly.
And
Yeah.
I don't try to become an expert in something that I didn't train in.
Okay. So now there's hospitality and there's hospital. So if I was to take you back in you being 10 years of age, what did you want to be then?
Very interesting. Many different things.
Okay.
When I was very young, and I'm still I was fascinated by the First and Second World War. So I would read a lot of comics of warfare and everything like that. And maybe at that time I would toy with maybe joining the military or something. Until I realized that people die.
Yes, people die. We don't come back.
So that was not as attractive. And then in my heart of heart, I wanted also to become a lawyer.
What changed?
Well, in Kenya, I still is now. I qualified, but there are always limited number of places. So you meet the minimum qualification. We didn't have parallel or private universities then. So you meet the minimum, but then you'd only go to the government institutions. So that sort of then limits your choices. What to do.
Okay, for me, funny enough, I used to make a joke around the military old things. I'm like, I'm glad I was born a Kenyan, because I usually used to also read or watch a lot of action movies, and I would see a mom being so sad that he had to lose all the sons. Actually, there's a movie with my name. Is it Private Ryan?
Yes.
Something. So I was like, I saw her and I was like, now I'm imagining a Kenyan mom having to give all his sons to the war and none comes back.
Yes.
And you only get to be applauded or something like that. And I'm like, where?
You get a posthumous medal.
I'm just like, where? I'm glad we are Kenyans, because okay, I know of course the war affected most parts, and maybe I'm not well versed about it, but then I feel like it had to affect something because it's historical and all that, and most people are aware of it. Anyway, ask me a question.
No, so if you didn't take the military, so then what did you go for then?
For me?
Yes, that's the question. What did you end up doing then?
What I ended up doing?
Yeah, because you said when you're growing up you wanted to be in the military.
Not to be. I said I used to watch lots of. Yes.
Okay.
I never saw myself holding a gun or anything like that. Maybe being of service within there, but then I never tried that, so I can't really tell if it's something that was, among my wishes. But anyway, my dream was to become a pilot then, of course a journalist then, and then there was also law, but that was more of inspired by my dad. Yeah, but then I ended up being the second, a journalist.
Okay.
Yeah. So you have a question for me?
How many books do you read in a week?
In a week? Not so many. Actually, I'm reading one which has taken so long for me to finish. Maybe if I was to answer that, I'd say I do a lot of research, so I do research books. But then you see that's guided to maybe an assignment I'm working on. Yeah. But then the ones that I'm really aware, it's just one book until I complete it. I binge read, if that's a thing.
Okay.
Yes. Okay. Now another question for you: if you are not in healthcare leadership, what would you be doing?
Are you asking?
Other than hospitality, because I know you may take me back to hospitality. Maybe you would have still been in hospitality.
I mean, are you talking about prior years or right now?
Right now.
If I was not.
But then right now, good question. Good question.
Yes.
Let me rephrase that.
Yes.
Currently, because now we were talking about then. What are you doing right now?
So I do several things, and part of what I've done since I left active employment is I've been working as a consultant, and of that I've worked in project management. So I've worked in getting hospitals equipped and
I was waiting for that actually.
equipped and started. I also do consultancy work around strategy, and I also do executive coaching.
Okay.
And then for my philanthropy work, I'm involved in many charitable projects. So I sit on roughly maybe 4 non-profit boards as well. So they range from maybe being in my church parish council to being on the board of a secondary school we started in Rarieda, running a program in my church which actually brings children who have dropped out of school, primary school, back to school. We teach them literacy, maths, and then we take them back to public school. It takes about a year. I'm involved in the establishment of a village polytechnic up country, and also I chair the board of a private hospital.
What inspires all those cards? With the way you're numbering them, I'm quite sure I reached 7. So what inspires that? You being okay, because currently you've said you're not under employment basis, so there's the consultancy, there is the coaching, there is you being part of even your village, back in the village, in the vocational training you mentioned. Yes. So what inspires that?
I think for me is a consciousness from very young time of wanting to get involved with the communities and seeing change. So coaching is, I feel that for young people who, when they look at my background, they also similarly want to become achievers. So my personality profile is that of a coach. I lead teams, I guide them, I coach them, and so I'm also able to work with young executives or mid-tier executives or C-suite executives to help them also achieve their potential. Serving on boards is me sharing my years of experience in strategic thinking, decision making, and overall oversight of organizations. Part of giving back, because a lot of them I'm just volunteering my time. And then for my community is I have the status of community leader. So sometimes I want to pull back, and the community says, "No, Gordon, we're not going to work without you." So I feel privileged to be invited to be able to serve and offer skills but normally it's helping use your networks, connecting people to resources, and also just inspiring change.
Okay. And that means you must be, and I'm strong on the must, good at your job, because even for the fact that people say we cannot imagine not working with you. Well, okay, that's commendable. But then what is that one thing that, the rest of the world who is not in the hospital, who have never been in the hospital life, you would say that we are not aware of, that you learned, within your leadership time in both Gertrude's and National Hospital?
So one of the things that, and I laugh about it, there's a big thing about gender, which is to the disadvantage of the boy child, because everybody sees gender as women.
Women, exactly.
Now, the healthcare industry is 85% workforce is female.
Okay.
Is female. So one of the things as a man, you learn how to lead a female workforce.
Here you'll have to awaken your emotional side. I know, get it.
Not really.
Yes.
Not really. You see, and that's what people don't. So let's give an example.
Okay.
You go to a management team meeting, and you've got all your senior exco, then you've got the other heads of department you meet. It was not strange for us to be in a room of 20 to 25, and we'd only be 5 men. In that room, the rest would be female, because the nurses are the ones who run through leadership and end up leading. And even now in medical schools in this country, there are more female doctors than male. So that's what a lot of people don't know. So I laugh at gender affirmative action, while in healthcare women make excellent leaders without the need for any affirmative action.
Yeah.
So sometimes I laugh and I see all these hullabaloo because they say that if you're a leader, regardless of gender or anything, you'll always rise to the top.
Okay.
You have to be good and you'll rise.
Well, okay, that also reminds me of a conversation. It's totally different from your thought process. But then I was thinking, I remember I was having this conversation with a friend around obstetrics and gynecologists. And we were like, I've not done a background check, but then I was like, I feel like in the obs and gyn, it's more male than female. And the fact that it's the specialization is around women.
Yeah.
And I'm like, yeah, it makes much sense, because when now we come down to what you say, the thought of leadership and women and the fact that also gender is just circulated around being a female.
Yeah.
That speaks, a lot.
Yeah, so let's say just be authentic as a leader. Be yourself. Don't look at it from a gender perspective, but use your gender to also advance your career. Learn to smile.
Okay. Okay, you got me to smile. I don't know if I've smiled since then. Anyway, now let's get to leadership and management. So now you being in the positions that you were at, and especially now that I've learned that you transitioned from hospitality to now, health leadership. Managing a hospital is not only having the doctors and maybe also other CEOs, because we have the staff, we have the patients, we have the stakeholders as well. So how did you get to jungle all that?
So the biggest thing for me is what I learned about from hospitality is standardization. So you healthcare suffers from variability of service, and it's characterized by long waiting times. It's characterized by unavailability of the professionals when you need them, scarcity of workforce and everything. So the biggest thing that kept me awake is how do you standardize what you offer? As you increase your volume, as you increase your services to scale, how do you stay to the core?
Yes.
And the only way you can do that is by having standards. So we, for instance, started with a basic ISO certification. And by the time I left, Gertrude was already Joint Commission International Accredited, which is a big international accreditation. There's still very few hospitals in the region who still have it. Well, that's the way that you actually be able to achieve this, because that takes care of everything. Those standards require to look after every single one of your stakeholders. And it also requires you to be patient-centric. Run your services around the person that you're serving, who is the patient. While a lot of our health institutions, we forget that, and the patient is, and that's what you call a patient. That's what they make fun. Say you're patient because you're patient, you have to keep waiting.
You have to be patient.
So it's having that focus. And also for me, it was also having what you call it, multidisciplinary training. So you break down silos and barriers. So basically, if you have a training session, you have all the professionals allied to medicine in the same room, you have the support staff in the same room, you have the medical staff in the same room, and you learn together. So it breaks down the silos where people only see
that is more talking about team.
As department, their team dynamics. You really enhance teamwork throughout the organization.
That's interesting. Actually, I'm getting to also learn the fact that you first get to understand that these are my challenges. That yes, the workforce, things are growing fast, and I can have less workforce towards still reaching what I am supposed to do to my clientele. I know that's not a good term for patient, but then still they are. And you now have everything focused centrally to the patient, who is now the client. Great. And now that is one skill that you got to hold on, and always to remind you that this is who we are servicing. So regardless of whatever you're facing, we have to work around everything and get to know how we're going to serve the patient
Yes.
to the greatest standard.
Yes.
So what other more leadership principles kept you?
I think, for one, I always try to have a training, staff training, and I always introduce a training which is called Quality Wise, which you try and make sure that every single employee goes through that training, so they understand what is the meaning of in simple terms, what is quality, how they apply it in everything else. The advantage I had with my experience in the hospitality industry, we had that kind of training, and the trainers who do the training used to use a manual based on healthcare. So it was quite easy for us to apply it. And then to make people understand that healthcare is a business, which most people don't understand. Yes, it's all about saving lives, good outcomes, and patient care and all that. But then, so we also train people on what is called business-wise. So every single thing that you do, how is that adding value, reducing waste, pricing fairly and all that. So everybody now starts being geared in terms of looking at things from a business perspective and looking at things as from the quality perspective.
So those are two, quality-wise and business-wise. If you could add two more other leadership.
For me, people always ask me, what's the biggest touch? I used to say treating everybody like a human. So it's very easy to be, particularly for us who work with pain, to have our feelings jaded and to lose a sense of empathy, and that kind of thing. But if you bring that into the workforce, work with your HR team, that you bring respect into the organization, you bring care and understanding among all your teams, and people become very, 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 very humane in what they're doing, then you're actually able to do that.
Okay. Now to your big mistakes that became big lessons.
I think for me, I can say you work with teams in an element of trust. So some of the big mistakes I would say is trusting people too much, and that can lead to hurting you later on. Although I'm a trusting person, so I find it hard to say I've learned because I was so.
For me, I was forced to learn. I used every time I get to be. I hope this helps you now.
Yes.
Every time I get to, because I used to be a people pleaser once. And then when I meet you, I'm already at 100 with you.
Yes.
Now I start to reduce. So every time I meet someone, I have to remind myself that no, we're not starting at 100, we're starting at 0.
Yes.
Let them feed into that person. Let them rise with you. And every time I get to feel like I'm getting too easy, I start by doing that. I just like snap out of it. It took so much time to get there. Then people can still be, actually the term in my head is nyooks. It just had to come out. So yes, and it's a great thing to say that yes, those who will walk with you with all genuinity and support and all that, but then there's still the other, and we have to accept it, that trust can also be a big dish hole for you. Okay. That was a great and insightful conversation with Gordon Otieno Odundo. We've got to learn a lot about leadership, management in the health space, and something that is still an O for me, and I believe most will be in the same basket and circle, is the fact that for you to be a health leader, it doesn't necessarily have you to be trained at first as, be in the medical space or in a medical school, in a medical institution, or a medical institution serves well for hospitals and all that. So yes, it's more of passion. That's what I get from him. And in the next episode, I hope we get to delve more into his leadership as well. Still, there's more to know about that. And see you next.